All right, guys, what's up? You know what time it is. It is your monthly house call with Twin Doctors TV, aka Dr. I, aka what did I say? AKA Dr. I and Dr. J. So you know how this works. Do you have any questions, by the way?
No, we actually are ill prepared. But you know how this works, basically, guys. Okay, send us your questions. Doesn't matter the topic. It can be general medicine. It can be women's health, mental health. It doesn't matter. Forgive my voice today. I've got a little bit of laryngitis. Sound horrible, but I feel pretty good. But send us your questions. We will answer them live. Normally when this thing kicks off, initially it's kind of slow as people are chiming in, but then the questions start to flow in pretty quickly. So if you have questions, jump on now, hit us early. In the meantime,
you keep talking while I find this question. Keep talking.
In the meantime, we've got some questions that viewers sent us prior to going live that we're gonna address.
Okay, keep talking. I'm looking for the question. Keep talking. Keep it busy.
Okay, all right. Well, so the holidays are coming, right, folks? Well, the holidays have already come, because we've just finished Thanksgiving, and now we've got Christmas coming next. And for a lot of people, that means the battle with the bulge, right? So, a few tips for you if you want to enjoy your holidays.
I'm done with the question now. Go ahead, finish your tips.
That's fine.
Finish your tips.
It's all about the questions. It is
okay, all right. So this is from a patient. I'm not going to say her name. She said she doesn't want to remain anonymous, but I'll keep her anonymous anyway. So she was asking about vitamin D, happy lights, and depression. And so I think this question came up because we were talking about it on another venue that's very nice, but not as good as BDO. Nothing as good as BDO, blackdoctor.org. But what we were talking about was SAD, or seasonal affective disorder, which is basically a form of depression that people get during the winter months if you happen to live in a cold, dreary, snowy environment like we do here in Chicago, and I still love it. It's my hometown. So anyway, so we're talking about seasonal affective disorder and some things that you can do to kind of ameliorate the symptoms, make them better. And so I was very honest. I broke down and said, I suffer from seasonal, no, I didn't break down, but I do suffer from a seasonal affective disorder. And so I was saying some things that I had done. And so one thing that I did was I actually bought what they call a happy light. And a happy light is actually, it's a light, it's non-UV, but it is filtered white light. And so my kids make fun of me because they come to the bedroom and like this big spotlight is on the dresser, like, pointing on me. But what it does basically is it mimics the sunlight that we just don't get. Like I have a little counter going like it is day number, like I'm in prison, it's day number 37 without any sunshine. But what this does is it mimics sunlight. So it kind of, and it's not just the mimicking of sunlight that helps it work. But what it does is it increases the levels of serotonin and it decreases the levels of melatonin. Serotonin is that happy hormone, and so when the serotonin levels go up, you feel happier. But during these really long, dark days, you don't have as much serotonin, so you feel a little more depressed. Melatonin, on the other side, is that hormone that makes you feel sleepy. And so when it's dark all the time, you're releasing more and more and more melatonin, your body's like, let's go to bed, and so that makes you kind of feel dreary and down. And so by having this light on you, increase serotonin, decrease melatonin. So that's one thing we were talking about. The other thing was vitamin D, and she was asking in particular, because sunlight helps you to synthesize vitamin D in your body, so she was asking, does a happy light help with vitamin D? Unfortunately, the happy light makes you happy, but it does not help with vitamin D because the vitamin D conversion actually comes from the UV in sunlight, and this just doesn't have UV, so it's not going to help you convert your or produce your vitamin D. But I still tell people take vitamin D. Some other things we're talking about the sunrise clock. That's something else I got too, and what it does basically is, because again, when you are in these dark environments where it gets dark at 4:30 and it doesn't get light until 7, usually when you're waking up, it is still dark outside. At least it is for me. And so what these sunrise clocks do is, it's about that big, it's like a little light, but it starts off dark when you're in your dark room sleeping. And then if you set your clock for say 5:30, at 5:15 it gets a little bright. Then it gets slowly brighter. As an ancillary, mine has like little chirping birds sound like, so and so what it does is it kind of mimics sunrise. And so again, it kind of gets your melatonin levels to start to drop, so you're not waking up when it's still black and your melatonin levels are super high. Kind of I guess I don't know if it's a funny story, but my wife almost broke my clock this weekend because I had the alarm on and I forgot I was on call, and it started going off at like 4:30 in the morning. She didn't know it was there, so she just heard these birds chirping, and she was sleeping like this, a crazy bird in my house, and then she kind of woke up a little bit and she saw it was a clock, but she couldn't figure out how to turn it off because the button was on the bottom, and needless to say, my clock almost died. But anyway, so those are some things you can do. Seasonal affective disorder, super common. It's what they call winter depression or seasonal depression. Happy lights help. The sunrise clock helps. You can also just take things like St. John's wort, which is good for depression in general, but it also helps with seasonal affective disorder. So those are some things you can do.
Yeah. And I think that the importance or the topic of seasonal affective disorder also speaks more to the importance of
mental health in general?
Well, not just mental health, but also getting a good night's sleep. So, you know, our bodies, we're part of nature, and our bodies are wired in such a way that when we have a normal rhythm, a normal cycle, we tend to be healthier. And sleep is part of a normal rhythm, part of a normal cycle. Part of the reason I think I'm sick now, other than the fact that somebody gave me their adenovirus or rhinovirus, is the fact that I don't get enough sleep. So what ends up happening in the morning, I always tell my kids this story and they just love it, but I tell them, you know, you open your eyes, and as soon as the sunlight hits your eyes are like, good morning, sunshine. And literally what happens is the sunshine will send signals to your brain to tell your brain the day has started, it's time to get up, it's time to go. What then happens is your brain sends signals to various parts of your body that help you to get up and go. And so you release hormones that help to boost your blood sugar so that you have the energy you need to get through the day. You release hormones that boost your blood pressure, boost your heart rate so that you have the energy again to get through your day. And then as the sun kind of reaches the zenith in the sky, starts to go down, you have fewer of those signals telling your brain, hey, the day has started, and then your brain starts to release, instead of serotonin, which is that happy hormone that he talked about earlier, start to release melatonin. And melatonin tells your body, okay, it's time to slow down. So your body starts to release hormones that do the opposite and help you to slow down, and then eventually to fall asleep. Now, when you're not sleeping properly, your circadian rhythms are thrown off, because what I just described is basically your circadian rhythms. When your circadian rhythms are thrown off, the hormones that help you get going throughout the day stay high throughout both the day and night. It's not good. It means your blood sugar is persistently high. Excuse me. Blood pressure is persistently high. Heart rate is persistently high. And what's going to happen? That's when you start to see diabetes, high blood pressure, higher risk of heart attack and stroke. And you tend to see that your immune system is compromised. Because
he's not going to make it, guys. Ask him a question. He's not going to make it.
Because when your body releases these chemicals like cortisol to help you get through the day, they also tamp down the activity of your immune system. And if you have that happening over a prolonged period of time, you're more prone to illnesses. So, yeah, getting a good night's sleep is important. Using things like the sunlight clock, the happy light, both can help prevent the mood disturbances that come along with wintertime and can help to improve your circadian rhythms.
Okay, intermittent fasting and the keto diet for weight loss, your opinion?
So intermittent fasting has actually been proven to help with weight loss, and it's just good for your health in general. So what intermittent fasting is basically kind of like what it sounds like. When you fast for a prescribed amount of time, for most folks they'll do between 8 and 12-hour fasts. You want to do it for at least 10 consecutive days, up to 30-ish consecutive days a month. But basically what happens is when you're doing intermittent fasting, your insulin levels are going to go down, because insulin is the hormone that your body produces to help you to deal with all the sugar that you're eating, to kind of help your body, your muscles take it up. So your insulin levels go down. For a lot of us, we are what is known as insulin resistant or pre-diabetic. And so basically what that is when you overproduce insulin because your body is resistant to it. And we see that in a lot of people that are obese, which unfortunately a lot of Americans are. So when you're doing intermittent fasting, you hope to regulate your insulin levels. That's one thing. But it also helps with your and by regulating insulin levels, that can help with weight loss. But it also helps with your metabolism.
Go ahead.
No, go ahead.
I was just going to say an added benefit. I mean, most people who are doing the intermittent fasting are thinking about the weight loss, and it's good, but also research has shown that when you do intermittent fasting, because you're not getting as many calories as you normally would, your body has to start prioritizing. And so your body says, well, what's most important? If we only have a limited number of calories, we need to make sure the brain gets those calories, the heart gets those calories, the vital organs. And what it ends up doing is it will sacrifice, for lack of better terms, other parts of the body. And research has shown that one thing that's sacrificed is your immune system, which sounds bad, but it's really not. So what ends up happening is your body gets rid of all of these old immune cells, these old lymphocytes, these old white blood cells, these old neutrophils, which are different cells that help to fight infection. When that happens in the short term, you may be a little bit more prone to infection, but then long term what ends up happening is it then makes newer, more capable cells. And so they've actually shown that in addition to helping with weight loss, boosting metabolism, preventing insulin resistance, you also tend to, oh, thank you very much, you also tend to see heightened immunity. And so the intermittent fasting is good for weight loss, boosting metabolism, and improving your immune system, so you're less prone to infection. So it's a good thing. And then the keto diet is basically
low carb. It's a low carb diet.
It's a low carb diet, and they call it the keto diet, I think, at least, because anytime you're in starvation mode, your body produces what are called ketones, and so you have higher levels of ketones when you're starving, basically. But it's basically just a low carb diet. Any diet that decreases,
carbs.
decreases your caloric intake is going to work, though.
But I always, and if we have another question, I'll be really quick. But I always tell people while these are, I don't want to necessarily say fads, but while these are good fads, for lack of a better term, for weight loss, you also have to kind of start to slowly transition back to eating a normal diet, but you have to learn how to maintain your weight while still eating a balanced diet. So carbs are, they serve a purpose. You don't want to overeat carbs, but you want to eat carbs, within a certain amount. So you just have to make sure that you can make that transition once you've reached the goals to kind of, for the rest of your life. Go ahead.
I was diagnosed with MS, but every neurology center will never give me an appointment. What can I do?
So this is the thing. So if you were diagnosed with multiple sclerosis, I guess the question would be why they're not giving you the appointment. Sometimes it's something as simple as insurance, and if it's an insurance issue, I always tell people to call your insurance directly and say, this is my insurance, this is my issue, I need to see a neurologist. Who's in network. So maybe something as simple as that. So if you can maybe share with us why they're not giving you the appointment, because it would be important. Sorry.
Well, I was just going to say, if the diagnosis of MS was made, my question would be who made the diagnosis, and then it's kind of their responsibility to refer you to a neurologist. And so they shouldn't just tell you, like, you've got MS, go find a neurologist. They should say, you've got MS, this is what it is, these are the consequences, this is what to expect, and we're going to refer you to a neurologist. And then most doctors' offices at least have someone whose job it is basically to check what's called your EOB, or explanation of benefits, what's covered, what's not covered, where it's covered, where it's not, and they are responsible for helping you find a neurologist that's in network. So I would turn to whoever it was that made that original diagnosis and tell them that, you need to get in to see somebody. It's to their advantage to do it because they're responsible for your care until they refer you to someone who can better take care of you.
And we're just guessing on that one. So if there's another reason why you can't get in, please let us know. We'll try and answer better than that if that's not why. Sorry, go ahead.
What are the symptoms of liver disease?
Well, so I mean, there are a multitude of liver diseases, but basically, if you look at the role of the liver, you can kind of determine the symptoms that you're going to get when it's not working properly. So the liver does a lot of stuff, but one of the main jobs is to clean toxins out of the body. Right. Also helps in the process of recycling old red blood cells. And so oftentimes when people have liver disease, you get a buildup of toxins, and so you may start to notice that you're having headaches. Oftentimes people will notice things like visual disturbances because you get a buildup of ammonia in the system.
Fluid retention is a big one.
Secondly, you tend to get a lot of fluid retention, but normally it's belly, waist, and below, so not necessarily so much above the waist, although it can sometimes happen above the waist as well.
And then
also,
the biggest one is jaundice.
You tend to see jaundice because when your red blood cells are being cycled,
there's a breakdown process called bilirubin.
Called bilirubin, exactly, and the bilirubin levels start to build up in the blood. Eventually it starts to seep out into the skin, gives the skin and the eyeballs kind of a yellow discoloration. So if you're noticing that your skin looks yellow, eyes look yellow, you're having pain in the upper right side of the abdomen, you're getting a lot of unexplained swelling, a lot of just generalized symptoms like malaise, fatigue, headaches, then it could be an indication that there's liver disease.
And then it becomes more a matter of what the liver disease is. If people are currently, overindulging in alcohol, or they've overindulged in alcohol in the past, it could be something like cirrhosis. It could be something as simple as a viral infection. It could be like hepatitis A, which you get from eating tainted foods, very easy to treat. It could be hepatitis B or C. And honestly, hepatitis C used to be not necessarily a death sentence, but it used to be a chronic condition, but now it's actually treatable. So if it's hepatitis, most of those can be treated. If we're talking more like gallbladder disease,
sometimes
it could be the gallbladder.
Sometimes it's medications you're taking because
exactly.
the liver helps to filter out toxins and medications and drugs as well. And so if you're taking too much of certain medications, that can cause liver dysfunction. So go see your doctor. They can do what are called LFTs, liver function tests. That helps them determine, if there is any liver disease to begin with, and then they can kind of go down the various pathways.
Check for they're probably doing ultrasound, maybe do a biopsy.
What the
if you have a more specific question, follow up with us.
How do we as Black people deal with hirsutism? And what natural remedy would help me? I'm desperate.
So this is the hirsutism is it's kind of a generic term for male-like features in women. So the most common things you see with people that have hirsutism would be hair growth in certain places. Sometimes there's obesity.
Well, not certain places that you normally wouldn't see.
Right. So you see that on the face, chest,
thighs.
Sometimes it'll be like a male pattern balding. You'll see obesity. You'll see acne. You'll see things like that. So the first question you want to ask is why you have the hirsutism. Generally, if you're having hirsutism, it's because of a hormonal imbalance, and in particular, it's an overproduction of testosterone. Women have testosterone, not to the same levels that men do, but if your testosterone levels are higher than they should be, that can definitely cause hirsutism. Sometimes it can be something like PCOS or polycystic ovarian syndrome that's causing it. Sometimes you can have a tumor on the adrenal gland, which is a gland that's right above the kidneys that overproduces testosterone. Sometimes you can have it on the ovary. So you want to know, A, why your testosterone levels are high. That's the first thing. Because if it is something more like a tumor, there's not a lot you can necessarily do to treat it naturally, just removing the tumor. If it is more along the lines of PCOS, which is what it is for most people, and there's certain things you can do. A, lifestyle changes. Diet and exercise will help to remedy all of those hormonal imbalances that you see with PCOS, including dropping the testosterone level down. I tell people, although it sounds a little paradoxical, there are a lot of hormones in the foods we eat. People think more along the lines of estrogens if you're not eating organic meat, and there are a lot of estrogens, but there are also testosterones, but also by reducing the estrogen levels, you actually can reduce the levels of all of the hormones that are being overproduced. So sticking to organic foods helps.
And then oftentimes when you talk about a natural approach to PCOS, one of the simplest things you can do is just weight loss. There's a very tight correlation between carrying too much weight and PCOS, and research has shown that losing as little as 5 pounds, regardless of how much weight, additional weight you may have, losing as little as 5 pounds can help to regulate the cycles. Because what happens with PCOS, which is the cause of the majority of hirsutism that we see, is that the ovaries, just like the testicles, like he was saying, produce testosterone. Now they produce testosterone, but then use it to make progesterone, which is the other female hormone. When you don't make progesterone, i.e. when you're not ovulating, when you're not having a normal cycle, that testosterone is not being converted to progesterone, the levels start to increase, you start to see the abnormal hair growth. Weight loss helps to promote normal cycles again, converting that testosterone to progesterone. So that's oftentimes the most natural thing you can do. But like you said, the main thing is you need to figure out what the cause is. Sometimes there are natural alternatives, sometimes there aren't.
What meds are good for agoraphobia and anxiety attacks?
So agoraphobia and anxiety. So agoraphobia is when you have a phobia of being out in public, basically. And oftentimes agoraphobics will have anxiety attacks when they're out in public. That's kind of their trigger. Agoraphobia is basically just a variant of an anxiety disorder, and so oftentimes you'll use what are called anxiolytics, which are anxiety-busting medications. You have medications like the Xanax, for example, and a lot of different medications in that class, and they are short-term anxiolytics. So you take them when you're symptomatic, when you're in public having the anxiety attack, or if you know that it's a given. Right, when you go out in public, you're going to have that anxiety attack. People will take it right before. They're short-term, though. They may be helpful for a couple of hours, and then, you may need to medicate again. So oftentimes what we encourage people to do if they have a phobia, the good thing about a phobia is you have a documented trigger, right? Like sometimes people have anxiety disorders, but there isn't necessarily a trigger. They'll tell you, I feel anxious with this, I feel anxious with this, I feel anxious with this. With agoraphobia, there's a trigger. It's going on in public. And so oftentimes getting behavioral therapy or talk therapy can help. Another thing, it sounds, like something you'd hear or something you see in a movie, but hypnotism can help. Oftentimes there is an underlying event or trauma that led to the agoraphobia. And oftentimes it's only through hypnotism that you can kind of regress, for lack of better terms, identify what that is and start to address it. But short term, anxiolytics will do the trick.
And also, if like you're saying about anxiolytics, like that's for short term. If you don't want to necessarily take something, as needed, there are other classes of medications like SSRIs that you take on a regular basis that help to overall bring your anxiety levels down. But I think the big thing, be it something you take short term like an Ativan or Xanax, or something you take long term every day like an SSRI, you definitely want to consider medication. You want to find what that trigger is. Talk therapy is super important. Hypnotherapy is also something to consider. But most of the time these situations are treatable. So, and they're
thinking of an herb, valerian.
Valerian, absolutely, it's a good anxiolytic. But bringing it up full circle, it can also cause inflammation of your liver. So if you have liver disease, stay away from valerian.
I have pre-diabetes, taking the medication, eating right. It's been about 3 weeks. How soon will the medication help me? She's taking metformin 500 milligrams twice a day.
So this is the thing. So if you were diagnosed as pre-diabetic, it's either that your insulin levels were high or that your hemoglobin A1C was kind of borderline. So hemoglobin A1C is something that we measure in the blood, and it kind of gives us a rough idea of what your blood sugar average has been like for about 3 to 4 months. So what I usually tell people is you're going to at least wait 3 to 4 months to see a change. More than likely, if you're checking your blood sugar on a daily basis, you probably see it trending down. But the best way to see if it's really working well, because blood sugar is up, down, up, down, up, down all day, is the hemoglobin A1C, and more than likely your doctor will check that in 3 to 4 months. But keep up the good work.
How often should a person have a colonoscopy and begin at what age?
Well, so there's 2 answers. So if you have no family history of colon cancer, they typically say you start at age 50, and you will get the colonoscopy every 10 years, unless they find something on it, and they may say 3 years, 5 years. But basically, start at 50, do it every 2 years as long as the colonoscopies are clean. Now, if there's a family history, so you have a first-degree relative who's had colon cancer, then they say you want to start getting colonoscopies 10 years earlier than they were at the age of their diagnosis. So if they were 50 when they were diagnosed, you'd start at 40. If they were 40 when they were diagnosed, you'd start at 30. So if there's a family history, 10 years earlier than the age, and a first-degree relative, yeah, 10 years earlier than the age they were at the time of their diagnosis. If there's no family history, age 50, every 10 years thereafter.
And I always tell my patients, because people are really freaked out about the colonoscopy, and no one looks forward to it, but the worst part of the colonoscopy is the actual prep, because you've got to take medication to kind of clean your bowels out, so that means diarrhea for 24, 36 hours. Colonoscopy itself, most folks, you're pretty well anesthetized, you're pretty well medicated, you're not going to remember much of it, not a lot of discomfort associated with it. Super quick and super, super, super important, and like he was saying, every 3 to 10 years, it's not that big a deal. So make sure you get it done.
What helps with pancreatitis pain?
So pancreatitis, so this is so pancreatitis is an inflammation of the pancreas itself, and you really want to know why it is that you're having the pancreatitis pain. Again, kind of similar to the liver, the pancreas and the liver are kind of connected. If you overindulge in alcohol currently, then in the past, you're more prone to pancreatitis. But something that people don't always think about, if you have gallstones, which are in the gallbladder, it can also cause pancreatitis. So you want to figure out why it is that you're having pancreatitis itself.
Certain antibiotics.
Certain antibiotics. So if you have gallstones, sometimes just the gallstone diet, so staying away from things that are fatty, that are deep fried, that will help. If you have persistent symptoms with the gallstones and pancreatitis, they'll frequently just remove your gallbladder, what's called a cholecystectomy. So if it's gallstone related, stick to the gallbladder diet. If that doesn't do the trick, you may want to consider a cholecystectomy or having your gallbladder out. If it's related to current or past alcohol overindulgence, if it's current, you kind of want to reduce your alcohol intake. If it's past, sometimes there's not much you can do necessarily to combat the pain and discomfort, other than reducing your food intake when the pancreatitis occurs. But sometimes taking pancreatic enzymes will help. Sometimes, so that's something to consider. But you want to really kind of hone in on why you're having the pancreatitis pain, and if it's something that's addressable, address the reason.
Which antihistamines really work with high blood pressure?
So I guess, if you're talking about someone taking an antihistamine that has high blood pressure, or that have, okay, so yeah. I mean, honestly, most antihistamines will do what they need to do, if you have high blood pressure. And
they're not going to adversely affect.
Right, they're not going to adversely affect your blood pressure.
I mean, so I guess the short answer would be they should all be relatively equally effective. Be it your Benadryl, your Zyrtec, your Allegra, your Claritin. One thing you'll often find, though, and it's again not related to the blood pressure or blood pressure medication, but you often develop tolerances to antihistamines after a while. And so a lot of times we'll tell people to rotate. If you've been taking Allegra for 6 months and now it's not as effective, go to Claritin for 3 months. If that's no longer effective, go to Zyrtec. If that's no longer effective, go to Benadryl. And so oftentimes if you notice it's not working as well, probably not related to the blood pressure or blood pressure medication, you've just developed a tolerance to the one you're taking, rotate to one of the other ones.
But I will say, if you mean antihistamines, then my answer is dead on. If you're thinking of something like pseudoephedrine, Sudafed, things like that, which people also take if they have nasal congestion, that you can't take with high blood pressure. So there are certain medications like chloracetine, HBP, that are safe for people that have high blood pressure. So if you're thinking more along the lines of Sudafed, you can't do that, go with like a chloracetine. But if you're thinking strictly antihistamines, then any one is fine.
Is it good to take vitamin D 50,000 milligrams once a week?
Yep, it is. Okay, so this is the thing. So I think as physicians and in the general public, we're becoming more and more aware of how vitamin D deficient we are. And again, not to ask for your sympathy, because I live here in this cold, dry city, Chicago, love it, my hometown. But if you are not getting, kind of like I spoke about earlier, if you're not exposed to a lot of sunlight, which most of us are not, you're not going to synthesize your own vitamin D, so it's very important to be taking vitamin D. A lot of people that, again, when you're covering your skin, same thing. And then again, a lot of people of color, we don't necessarily synthesize quite as much vitamin D. So it is very important. And for most people, you can take a daily dose, but for most of my folks that are vitamin D deficient, I tell them take the 50,000 milligrams once a week.
Milligrams.
What is it?
Not milligrams.
Units, I'm sorry, IUs, yeah.
International.
Okay,
units.
Once a week.
they put milligrams, so.
Oh, international.
Yeah, so
units.
But
say
it's
that.
IU.
Yeah.
It is IU once a week. But it is very important. It is very important because most people start thinking about vitamin D and their bone health when they're 50 or above. And really, it's something that you have to.
But vitamin D is
it's not just for bone health. I know it's not just for bone health. But so vitamin D is something you actually should be supplementing with.
Immunity as well.
Immunity,
There's a
yes.
link between
Colon cancer.
Yeah.
Yeah.
Is surgical intervention best for sarcoma cancers?
Well, so it's hard to say. So when it comes to any cancer, the question of whether or not surgery is appropriate is oftentimes based upon a couple of things. One, the stage of the cancer, and then oftentimes also the grade of the cancer. And so when we look at cancers, we'll look at the stage 1, 2, 3, or 4. One's the least advanced, 4 is basically metastatic. It's the most advanced, and the 2 and 3 are intermediate. Again, it depends on the type of cancer, but oftentimes if it's like a stage 3 or a stage 4, meaning it's no longer confined to the original organ, it's metastasized elsewhere, then they won't necessarily move to surgery as a first step because surgery is just going to remove that initial mass, but if it's metastasized here and there, then it's still not doing anything for those metastatic lesions. And so instead, they'll oftentimes go with chemotherapy. It's a drug that's meant to kill the cancer. It goes in the bloodstream, so it gets the cancer here, there, and there. They may do targeted radiation to shrink lesions. And then if they've seen some response, they may proceed forward with surgery then. If you're talking about an early cancer, and again, it varies from organ to organ, but it's a general rule. If you're talking about an early cancer, stage 1, maybe a stage 2, oftentimes they'll start with surgery and then follow up with chemo or radiation. If it's a little bit more advanced, then surgery may not be an option at all, or it may not at least be the first option.
Is it true that fasting helps all people?
Well, I guess when you're asked to test, when there's all or never, you never choose those. So I don't know if I can say all people, but I'm sure there's someone, with maybe other medical conditions where you just don't want to fast. But the benefits of fasting are pretty universal because, white, black, fat, skinny, tall, short, our bodies all work the same on the inside, And so those benefits of fasting, reducing insulin levels, increasing metabolism, reducing blood sugar levels, helping with cholesterol reduction, blood pressure reduction, it's pretty universal. So, again, everyone's personal situation may be different. If you're diabetic, if you're taking insulin, you don't want to do fasting in situations like that. But as a general rule, all comers, yes, fasting helps everybody.
Should a person have surgery if they have spinal stenosis?
Well, so spine surgery is always a little tricky.
Maybe we should probably say
No.
spinal stenosis.
Yeah. So first of all, spinal stenosis basically, you have your spinal cord, which is a big rope of nerves basically, and it runs down in the middle of the vertebrae, the bones of the spine. And so when you have spinal stenosis, one of those vertebrae, there may be a little bit of a narrowing of the passageway for the spinal cord to run through, so you get pressure there. Because you're talking about a bundle of nerves, it tends to be A, pretty painful, but B, the nerves that are beyond where that stenosis is located may not work as well also. And so surgery for spinal stenosis can be beneficial. The only issue becomes anytime you have surgery. So let me first say that yes, it's probably beneficial. But the one caveat is that anytime you have surgery, any part of the body, you're going to get inflammation resulting immediately after surgery, and scarring can result as well. And so sometimes what you end up seeing when you do surgery for spinal stenosis is the area where the stenosis was, it's been alleviated. If you get scarring, it mimics the stenosis, and you can start to have that pressure being applied to the nerves again, and you can have very similar symptoms. So I normally tell people, and again, every case is different, but it may not be the first step. You may want to consider physical therapy, steroid injections, things that are a little less aggressive. But if you're not getting relief, if the symptoms are getting worse, then surgery can be a good option, but there's always a possibility that you may not get the results you want because of the scar tissue that develops afterwards.
Yeah.
So is there a best natural remedy for menopause?
Okay, so this is the thing. So the best natural remedy I don't know if there's a single one best one, but there are a lot of good natural remedies for menopause. So again, the symptoms you are experiencing with menopause is because for the first, 45, 50, 55 years of your life, well, I guess not the first 10 or so, but for the majority of your life, your body's been exposed to these hormones, and so people think of the hormones as being something that just affects the genital organs, which they do, but hormones are kind of body-wide. And so what you notice is as these hormone levels fall off, so as your testosterone levels fall off, your estrogen levels fall off, your progesterone levels fall off, you're going to have, of course, genital symptoms, vaginal dryness, decreased lubrication, lack of orgasm. You also have bladder symptoms, so you end up with urinary frequency, leakage of urine, but you also have brain symptoms. So you have insomnia, you have depression, you have anger, increased risk of dementia. So the hormones really kind of affect everything top to bottom. And so I do recommend for my patients, if there is not a contraindication to medication, consider medications. In terms of natural things, again, you're trying to mimic the hormones that you're losing. You're trying to mimic the estrogen, the progesterone, the testosterone. So you want to take natural versions of this. So there are medications over the counter, which are plant-based estrogens that help. Soy is a big one. You can drink soy milk, eat soy ice cream, eat, what is that?
Tofu.
Tofu, thank you. Eat tofu. All these things are high in soy, and so that will mimic the soy and increase estrogen levels in your body, so that helps. There are other things you can do. Black cohosh is a good one. Black cohosh will also mimic estrogen to a degree and really reduce some of those menopausal symptoms.
Raspberry leaf tea.
Raspberry leaf tea, that's a good one. Red raspberry leaf tea is one that will do that as well. So there are a lot of good options. Think of red raspberry leaf tea, think of black cohosh, think of estrogen, think of things that have soy in them. All of those will help. If it doesn't help enough, there are medications that you can take that aren't actual hormone replacement, and we can talk about that too. People kind of, hormone replacement has its issues, but they're not as bad as people think. But there are medications you can take that are non-hormonal. So there's a medication called clonidine. There's a medication called paroxetine. All of these are medications, but they're not
for the hot flashes.
But which is what a lot of people complain. But yeah. So there are tons of options: natural medications that are not hormonal, and then various forms of hormones as well. So let's start with the natural options first.
Fibroids shrinking instead of surgery?
So first of all, fibroids, very common in people just in general, but especially African Americans, and they're benign tumors of the muscle of the uterus. There are a variety of treatments for fibroids. One is what we call expectant management, which is a fancy way of saying that you don't do anything. Fibroids are stimulated by estrogen, which you make with your cycles. Most women, once they get to and through menopause, estrogen levels decrease. They don't have that fuel for the fibroids. That oftentimes, in and of itself, will shrink them. For most people, though, because of the pain associated with the fibroids, the bleeding, they can't wait necessarily 10, 15, 20 years for menopause. So another option, again, it feels like we go to this for everything, but weight loss. What ends up happening, like I said, fibroids are fueled by estrogen. All people, male, female, if you have extra fat tissue, it makes a form of estrogen called estrone. Estrone can stimulate fibroids, so weight loss can help. Avoiding sources of potential exogenous hormones. So eating organic meats, for example, organic milk. Yeah, that aren't treated, exactly. It's staying away from the soy because, like we said with the last one, it's a plant-based form of estrogen. These are all things you can do to help. There are also procedures you can do that can shrink fibroids without having to,
I think that's what you're probably getting at, UAE.
So exactly, there's something called UAE, uterine artery embolization, where they put a little catheter through the femoral artery here, thread it up to the uterus, find the branch or branches of the blood vessels that go to the fibroid, embolize those branches, meaning blocking them. You decrease the blood supply to them, they die. There's myomectomy, which is a surgical procedure, somewhat similar to the hysterectomy in terms of the approach we take. But with this, you remove the fibroid from the uterus, leave the uterus in place, you can preserve your fertility. Because with the uterine artery embolization, they normally say, don't try that after that. So there are a lot of options. There's a medication called Depolupron, stimulates an artificial menopause, same thing, shuts your ovaries down for a temporary period of time. You're not making estrogen, no estrogen, fibroids tend to shrink. So a lot of options.
But thinking specifically about the UAE, the uterine artery embolization, which is what I think she was asking about, it's a good option for someone that A, does not want to have children in the future, B, that it works better for people that have solitary fibroids, for one large fibroid or like two, decent sized fibroids. If you have multiple fibroids, not going to work as well necessarily. Some of the drawbacks, people report an intense pain afterwards because you're basically killing the fibroids, so that can be painful. There is a risk of infection afterwards because you have this dead tissue. But for most folks, they actually do well with it. The other drawback is that usually you'll have one or two big fibroids. They're tiny little ones that aren't necessarily visible. And what will happen is when you kill off the blood supply to the larger ones, the smaller ones, like, yay, they got all the blood, and they start to get bigger. So it's not necessarily a permanent fix. But again, it's relatively non-invasive. It's an outpatient procedure. I think if somebody is thinking more surgical, if they're a good candidate, it's something to consider before you move to bigger procedures. So.
Is silver water and black seed oil good for the body?
So silver water, there was this big, maybe 5 years ago, people were getting into colloidal silver, and they would literally drink a little bit of silver.
Yeah.
And the thought was that it would help to eliminate toxins and boost the immune system. Yeah. There hasn't been any research that has shown that silver is an effective, what we call coenzyme, that helps to boost the activity of the immune system. And there's been some research that shows that you can actually suffer ill effects from it because the silver tends to accumulate in the liver, for example, because the liver's like, we have to get this foreign substance out of the body. So you can boost the immune system
other ways.
The colloidal silver or silver water, it's not an essential mineral, meaning it's not a mineral that our body needs. It's not a mineral that our body is trained, for lack of better terms, to clear. And so I would probably steer clear of it, to be honest with you. Yeah.
You talked about black seed oil?
Oh, black seed oil. So black seed oil, I mean, same thing. It's good for the immune system. It's a good immune booster. And yeah, I actually take black seed oil myself. I think that while it's not something that the body makes naturally or is trained to clear, there haven't been any studies that show harm. So I'm a fan of black seed oil, but the silver water I stay away from.
Constant knee pain, what can you do even after cortisone shots, Motrin, ice, and heat?
So this is the thing. Generally, and again, you kind of want to figure out exactly why you're having knee pain. I'm guessing if they're treating you, they've already figured it out. But 99% of the time, it is what they call osteoarthritis. So if you're looking at the knee or really any large joint, you got these bones, but you have cartilage between the bones that kind of act as a cushion. But when you have osteoarthritis, that cartilage slowly wears down, and eventually you have bone on bone, and that's extremely painful. Like most conditions, kind of similar to spinal stenosis, they will generally start with less invasive options. So they'll do, non-steroidal anti-inflammatories. They'll recommend physical therapy, heat. They'll do cortisone, which is an anti-inflammatory. But it sounds like you've kind of exhausted all of the non-surgical options. Unfortunately, there's no way to grow the cartilage back. Once it's gone, it's gone. Unless injury is what caused the osteoarthritis, usually it's related to weight. Sometimes if people are heavier, you're just putting more weight on those joints, and that's kind of what wears the cartilage down. So what I tell people is weight loss helped, but then you probably want to consider joint replacement if it's painful and you've done everything else that you can do. And joint replacement surgery it's an intense surgery, and the recovery is intense. But in terms of your quality of life moving forward, it's probably the next best option.
I've been on dialysis for 6 years from stage 5 kidney failure due to polycystic kidney disease. For the past year, I've had collapsing veins, clogged arteries, and a bad mucus cough that won't go away. Is there any correlation between these symptoms and congestive, and it's ... Heart failure, maybe?
Well, so first of all, I'm sure most people know it anyway, but dialysis is what we do to clear the blood when the kidneys can't do it. So like we were saying earlier, the liver's job is to get rid of toxins. That's also what the kidneys do. And when the kidneys are no longer functioning properly, dialysis basically clears the blood for the kidneys. Polycystic kidney disease, there's 2 different types. There's one called autosomal dominant, one that's autosomal recessive. But they're hereditary conditions that basically result in big cysts in the kidneys and poor kidney function. And over time, the kidney function gets worse and worse and worse, and eventually you need to do dialysis. Now, there were quite a few symptoms. The collapsed veins, if anything, I'm not sure if you're referring to veins just everywhere or like the veins that they use for the dialysis. Over time, sometimes they have to redo those fistulas, so it could be a matter of them just needing to revise the fistula if they've been using the same fistula, which is it's a special blood vessel they kind of make, for lack of better terms, so that you can get the dialysis access. But if you're noticing a lot of dilated veins, what were the symptoms? You said dilated veins.
Dilated veins, clogged arteries, mucus cough.
So this is the thing. So my guess is it may not be related to the dialysis. I'm gonna have a house in D moment here.
Oh, it is congestive heart failure.
Okay, I was gonna say I'm gonna have a house in D moment, but it sounds to me like that's more cardiac. Because if you're having a mucousy cough, it could be that you have what they call pulmonary edema, which is fluid building up in the lungs. Because this is the thing, the heart is a big muscle, and the job of the heart is to squeeze the blood out from the heart to your extremities. But when the heart is not working as well, it's not squeezing the blood out as well. So you get a buildup of fluid in the lungs, and also the blood that's returning from your lower extremities back to your heart doesn't clear as well either. So you get swelling.
So like there's a traffic jam on the highway basically. The
Exactly.
heart can't get it out quickly enough. It can't fill up the heart as quickly, and so it starts to build up, and you get the inflammation. So that sounds a lot like congestive heart failure.
Yeah.
What you see a lot in people with dialysis, because again, what do the kidneys do? In addition to getting rid of the toxins, they get rid of all that extra fluid in the form of urine. If they're not getting enough of that fluid off the body, there's too much for the heart to pump. The heart's like, I can only do so much, and it gets congested basically. And the heart
And
starts
I
to
guess the
fail.
question was, is there a correlation between dialysis and years of heart failure? Yes, in the sense that it was, you know.
Yeah, if the kidney function is poor, and then the congestive heart failure can be worse, so you may need to do dialysis more often.
But they are separate conditions, so it may be a matter, like I said, of doing dialysis more often, but also there are medications what they call inotropes, which help the heart to pump better. And so it may be that you need to be on a medication like digitalis, digoxin, which is an inotrope, which will help the heart to function better. So definitely mention those symptoms to your doctor.
Can a Baker's cyst in the back of the knee be massaged out? I can feel it. It causes pain when driving and walking the stairs. What is the best solution to alleviate the pain?
Yeah, so unfortunately, the Baker's cyst can't be massaged out. Anytime you have a cyst, it's like a fluid-filled sac. I mean, I guess I suppose somebody could apply enough pressure maybe to cause it to rupture. But I don't know that
I was going to say, you know, like they'll do that with the cyst in the wrist, like the ganglion cyst. They'll literally get a book and smash it.
Yeah.
But when it's in the back of your knee, like literally, that's what they do. But when it's in the back of your knee, generally, no, I wouldn't necessarily recommend that because, like you said, it's full of fluid, and then if that fluid ruptures, it's going to irritate the tissues around it, and that can cause arthritis and some other
Oftentimes, though, the Baker's cyst can be drained.
They can be drained. And it's a pretty simple procedure.
Yeah.
Partial hysterectomy is the best thing for menopause or is natural?
Say that again?
It's not worded as a question. So I think she means is partial hysterectomy best thing for menopause or natural?
No.
Oh no, natural. No, I mean,
Well, no. I think what she's maybe asking is menopause after hysterectomy? I don't know. Well, maybe rephrase the question. Sorry,
yeah,
I don't want to guess.
I was thinking what you thought.
Yeah,
she was asking was the partial hysterectomy better or going natural?
No, I mean, if you can go through menopause naturally, it's better to go through menopause naturally. If you remove the uterus, the periods will stop because that's the source of the menstrual flow. If you remove the ovaries, that's just going to plunge you into menopause because they're no longer there to produce the hormones. But assuming there's no pathology with the uterus, tubes, ovaries, just going through menopause naturally is better. It's kind of like, I tell people, it's like induction of labor. When you have people who get labor induced, they say, oh, it was so much more painful than when I went into labor naturally. It's really not. Once you're in labor, you're in labor. When you go into labor naturally, it's this natural buildup, so you have time to acclimate. Same thing with menopause. If you go through menopause naturally, it's a buildup, so you have time to acclimate versus just remove the uterus, tubes, and ovaries, hormones gone, and it's like getting pushed into the deep end. So assuming the uterus, tubes, and ovaries are healthy, going through menopause naturally is certainly a better approach.
Okay. Oh. What was that lady's question? The lady with hirsutism.
Yes.
She said that the doctor placed her on birth control for it.
Yeah.
And she also has hyperhidrosis. So she said why. So she's asking why.
So hyperhidrosis and hirsutism kind of go hand in hand because...
Well, she's asking why she's on birth control?
Why did the doctor place her?
Basically, remember like I was saying earlier, when you have hirsutism, it means you're, in most cases, if it's like with the PCOS picture, it's because the ovaries are making too much testosterone. They make that testosterone to then use to make progesterone. But if you're not having normal cycles, you're not ovulating, you're not making progesterone, testosterone levels increase. So basically by doing birth control pills, it's like making you cycle properly. Yeah. So you are no longer having this excess buildup of testosterone because you're cycling properly. And so basically it's just done to...
And not only that, I mean, just when you put the hormones in the body for the body doesn't have to do the work. It's all a big feedback loop as well. So it kind of just reduces all hormone overproduction.
But basically, the short answer is it's meant to make you cycle properly so that your testosterone levels aren't building up. And it's a recognized approach,
What do you do with arthritis in both of your hips for the pain, non-narcotic?
Well, so this is the thing. With arthritis, but the same thing. So arthritis in the hips, again, we're talking those large joints. So frequently the arthritis in your hips will be right where the bone here in your thigh, the femur, enters the ball of the hip. And a lot of times it's the same thing. It's that cartilage has been worn away. Non-narcotic, I agree. For chronic conditions, you don't want to be on narcotics. But there are a lot of super effective non-narcotic options. The main ones that people will recommend are the non-steroidal anti-inflammatory drugs. Could be ibuprofen, could be Advil, could be Motrin. But there's something called Celebrex or celecoxib, which was super popular for a while, kind of fell off. Now it's coming back. It's what they call a COX-2 inhibitor. It actually tends to work a little bit better than most non-steroidals.
And it's not as rough on your stomach.
And it's not as rough on the stomach. Potential cardiac issues. Yeah. So you have to be a good candidate for it. But something like celecoxib, Celebrex would be something to consider. Again, cortisone injections. Literally, when you get a cortisone injection, you want to jump off that table and dance. Problem is it doesn't last forever. It'll last anywhere from like 1 to 3 months, so it's something you have to kind of keep doing. And then physical therapy helps. But really consider the non-steroidals, Celebrex if you're a candidate for it, steroid injections, physical therapy, that should help.
Your site says, blood pressure meds cause cancer. If you've taken hydrothiazide, what should I do?
I'm sorry, say it again?
Your website.
Our website says...
blood pressure meds cause cancer. If you've taken hydrothiazide, what should I do?
Honestly, I'm not.
Well, you wrote the primer on blood pressure, so I don't know what he's talking about.
I honestly have to see the line. I'm not quite sure. But in general, hydrochlorothiazide, as far as I know, hasn't been linked to any cancers. Now, there are certain blood pressure medications that have. There are what are called ARBs, angiotensin receptor blockers. There's one now called losartan that has been in the news lately because there's been some potential link between the use of these angiotensin receptor blockers and cancer. Hydrochlorothiazide, it's a diuretic. It makes you pee a lot.
It's not on that one.
I'm not familiar with any link. Maybe, yeah.
No, you probably did the article about
Yeah.
losartan because
be that,
that just came out.
Yeah.
So hydrochlorothiazide is not the blood pressure med that causes
It's
cancer.
ARBs, the angiotensin receptor blockers.
Yeah.
What's the best treatment for asthmatics? Maybe I should.
Well, it depends. I was going to say Dr. Renee is a severe asthmatic. But, so what asthma is, it is a spasm of the bronchioles, which are the airways in the lungs. And so it depends on the cause of your asthma, for one. For some people, they know their trigger. It could be colds, it could be food allergy related. So if you know your trigger, exercise. So if you know your trigger, stay away from it except unless it's exercise. But so that's number one. But number two, of course, and probably if you're an asthmatic, you have it, but rescue inhalers like albuterol. If you, again, know you're triggering something you can avoid, like exercise, use that inhaler before you even are exposed to the trigger. But again, it also depends on how severe your asthma is. One thing that people don't do enough is monitor their peak flows. Your peak flow is kind of it's a measure of how well your lungs are working, And so you want to do your peak flow, and it's a little cheap plastic machine. Every asthmatic
come in all sizes.
They come in all sizes. And you want to do your peak flow, you want to get your baseline peak flow when you're feeling your best. Because you want to see, ideally, how well your lungs are working at their best. And then really, even if you're not feeling as though you're having an exacerbation, but definitely feel like you're having one, you want to check your peak flow.
Because check them daily.
That's what I say. You really want to check them daily because you want to. What'll happen is your peak flows will start to come down before you feel the symptoms, and so that's how you know that your asthma is worsening before you even feel the symptoms of asthma.
And with the peak flow, they have the zones, and so it's a little guiding.
70%, 50%,
yellow,
30%,
red, and green zones.
Exactly. And so if your peak flow gets to that 70% of your best, that's when you're kind of getting to the danger area. You need to start, thinking about other treatments. There are, in addition to the albuterol, the rescue inhalers, there are steroid inhalers that you can take on a daily basis, like Flovent. So people that tend to have asthma that is problematic more than like twice per week, they recommend being on Flovent or one of the steroid inhalers. Advair.
Rio is the new one.
There are tons of them. There are also medications. There are medications like Singulair, which are mast cell stabilizers, mast cell stabilizers, because mast cells are cells that release these histamines, exactly. And so there are tons of medications. So the point is, you want to figure out what your triggers are, avoid the triggers as best you can. If you can't avoid the triggers, use your rescue inhaler before you experience the trigger. Or if you start to feel your asthma is coming on, use the rescue inhaler, don't let it get bad. Monitor your peak flow on a daily basis. Know what your best peak flow is. If you have more than 2 asthma attacks per week, consider being on a steroid inhaler, Flovent, Advair, and consider being on an oral medication as well, like Singulair.
See a pulmonologist.
Absolutely, see a pulmonologist, yes.
And you might need to see an allergist if you have allergies.
Absolutely.
And figure out what the allergies are.
Absolutely. Hope you heard Dr. Renee. See a pulmonologist and see an allergist.
What is the age that women start menopause?
Average age for menopause is 51.2.
8.
No,
Is it 2 or 8?
It's 2.
It's 51 and a half.
Yeah, 51 and a half.
Between 51 and 52.
But it's not considered if you start going through menopause at any time after 35. If you start going through menopause before 35, it's premature menopause. After 35, it's not considered premature.
Just early.
But yeah, it's just earlier than average, but not premature. But 51.2 to 51.8 is the average age.
This better be the last question. Right? Sorry, I gotta get my kids.
Oh, okay. So 2 more. What other issues will cause elevated PSA?
So this is the thing. So PSA is prostate-specific antigen. So it is PSA. So it is a substance that's
Not
produced by
public service announcement.
not public, but this is a PSA about PSA.
There you go.
And it is a substance that's produced by the prostate. So what we're looking at, what people are most concerned about is if you have an elevated PSA, you can have prostate cancer, which you definitely can. But anything that causes inflammation in the prostate can. So you can have what they call prostatitis, which is just a generic term for inflammation of the prostate that can be caused by infection. So if you have an infection, that can increase your PSA. If you've had prostatic manipulation, there are many ways to do that. That can also increase your PSA. As well as if you have precancerous lesions or cancer in the prostate. So if you have an increased PSA, you definitely want to kind of go down the road, maybe get an ultrasound and figure out why the prostate. You can have also an adenoma, which is a benign tumor that causes the PSA to be elevated. But if it's elevated, you kind of want to go down the road and figure out why.
Last question. How do you get rid of mucus out of the body?
Well, you know.
Well, so
No.
mucus is meant to be in the body. It's produced by the mucosal, what we call our mucosal lining, so the parts that are wet, basically, are wet in large part because of production of mucus. And mucus actually serves a really important role. We were actually talking about this earlier, totally unrelated, but mucus has a lot of really important stuff in it. One of the things it has is called mucin. Mucin is like this coating that prevents, which is germs in general, bacteria, fungi, yeast, viruses from binding onto things. And so when you have mucin lining parts of your body, it makes you infection resistant. Mucus also has lysosome and immunoglobulins, things that help to prevent, again, infection with bacteria and fungi and viruses and things like that. So you wouldn't necessarily want to rid your body of mucus because it serves an important role. Now, if you're having too much mucus production, it means your body's trying to ward something off.
Exactly.
And so you need to figure out what it is that it's insulting your body, what it is that your body's saying, hey, we don't want this here, let's make more mucus.
Use an environmental allergen.
Yeah, and avoid that. Normally it's like you said, an allergen, be it environmental, something outside or something inside. Dust, dander, pollen, whatever the case may be. And so one thing you can do is see an allergist, immunologist. They're doctors who specialize in the immune system and allergies. They can do what's called skin testing. Skin testing will tell you what it is potentially that you're allergic to. Oftentimes this is going to be the trigger or triggers that are causing your body to make too much mucus. But you don't necessarily want to get mucus. It's there for a reason, but you want to address whatever it is that's causing your body to make too much mucus.
But short term, if you have a hot date or something and you're making too much mucus, you can do like antihistamine, pseudoephedrine, things like that will help. But then you go to the other end and you'll be like dry as a bone. Like I use it once and I'd rather have the mucus. But options as well for the short term.
Okay, so the person with the hirsutism, she came back and said she doesn't have cycles anymore. What can she do?
Well, so again, it's probably PCOS. Birth control will usually help. Well, I was going to say birth control usually help. Weight loss helps. Metformin, which is a medication to reduce your insulin levels, also helps.
But sometimes the birth control, if you're on what's called a low dose monophasic.
Oh, you mean for long term birth control can also cause that?
Yeah, if it's like low estron, yeah, sometimes people stop getting their periods on that. So it could be that as well. I see the doctor. It means either the birth control is not doing its job or it's doing its job too well.
And if it's long term birth control, you should take a medication called Provera or progesterone, like 10 to 14 days every month. It kind of mimics the good effects of the birth control while still giving you a cycle every month.
All right, guys. Well, thanks for tuning in. You wouldn't know by looking at us, but we are really needy people. So what we need you guys to do is show BDO some love, which clearly you did because you're here, but also show us some love. We're Twin Doctors TV on Facebook. Follow us on Facebook. Like us on Twitter. Am I getting that right?
Yeah.
Follow us on Twitter. Like us on Facebook. Social media, Instagram. It's all Twin Doctors TV. Like us, follow us, show us some love. Our website, www.twindoctorstv.com. And as always, we'll be back here in 1 month for our monthly house call with BDO. If you have questions and you want us to get to them early, send them to us in advance, and we'll get to your questions first. Until then, guys, thanks for tuning in. Stay healthy.